Darnell.
Dr. Mosey. Kelly.
Dr. DeTulio.
Darnell.
Kelly.
Dr. DeTulio.
Thanks for seeing us.
Darnell and Kelly, thank you guys for coming in. We appreciate you guys coming to us to talk about this problem. I know it's a little bit embarrassing, but Darnell, we have come to the conclusion that it is you that is the cause of the infertility, and we know about the vasectomy reversal, and we found out that the cause of it is because of your testes.
So as we move on throughout this meeting, we're just going to kind of explain what your procedure was like in the past and what we can do moving forward regarding tests and procedures that will eventually happen. And we're just going to inform you guys so that you guys can make an educated decision while moving forward. So when you did have your vasectomy reversal, basically what happened is they connected the pathway so that the sperm can move and meet up with the semen. They did this by either connecting the broken ends of the vas deferens together, or they connected the vas deferens to the epididymis, allowing that pathway to be one so that it could reach the urethra, which usually allows people to become fertile, but in your case it did not. So we're going to move forward by just talking about some few tests that you can go about.
So now Darnell and Kelly, we are going to show you guys a chart based on like male fertility percentile and where you stand on it. So if you can see here, the problem in the testes, which is what is the cause of your infertility, is a 30 to 40 percentile. Blockage in pathway is a 10 to 20 percentile. Pituitary gland or hypothalamus is a 1 to 2 percentile. And then no identification is 40 to 50%. So knowing this percentile and the problem in the testes, we could go about further testing and figure out what to do next to solve the infertility.
What's the next step?
All right, so now I'm just going to explain a few of the tests that we can do proceeding forward with this process. A few of them are a testicular biopsy, which can be done in a physician's office with a local anesthetic. Basically, a surgeon just makes a small cut and takes out a piece of your testicular tissue. The procedure or test does range from $7,000 to $10,000, but it would give us great results. The other one is vasography, which basically we just take radiographic dye and we inject it into the testicles to see an image of the testes, to see what is going on within it. This test basically just shows if there's any blockages occurring so that we could proceed forward with a procedure to undo that blockage so that hopefully in the future you could become fertile. So another testing that we could do is genetic testing, which also can be very helpful. So these are a couple of them that we could do. The first one is a Y chromosome microdeletion test, which basically just sees if there's any Y chromosomes missing. The other one that we could do is a cystic fibrosis gene mutation test, which can affect your infertility. Not many people know that, but it can, so that could be very helpful as well. And then there is a karyotype testing as well, which basically just shows any kind of differences or problems within your system that can cause an infertility, but it's very rare. Only about 2 to 4% of people have it. And lastly, there is a syndrome called Klinefelter syndrome, and basically with that, it just shows up in men that have an extra X chromosome. So that also is related to the genetic testing. So we hope that isn't a factor, but it is. But if it is, we can move forward with a procedure that can help that.
So after the testing, we might find a syndrome called Sertoli cell-only syndrome. And this is when Sertoli cells only line the seminiferous tubules, and it's usually between the age of 20 to 40. It's usually like azoospermia, which is no sperm in the ejaculate, and there's no effective treatment for this syndrome.
So what are the procedures we can do after we get the results?
So there is various procedures that we could do depending on what the tests tell us, Darnell. One of them is a testicular sperm extraction, which is actually a pretty basic procedure where you are under a local anesthetic. The surgeon will just go in and extract some semen, and if sperm is found, we can use it later on for an ICSI, which is an intracytoplasmic sperm injection. which is pretty common. This cost is between $3,000 to $12,000 depending on how it goes. Another procedure that we can do that is very similar to the one that I just explained is a microsurgical epididymal sperm aspiration, otherwise known as MESA. It's very similar, like I said. You are under a local anesthetic, and it does extract sperm and semen, except this time it does go through the scrotum and the epididymis. So basically the same ending result, and while we do this, we can hopefully use that to help your wife become fertile in the end.
So another procedure we could do is a varicocele repair, and that's when they take the veins of the testes and tie them off, and then the one good vein, they leave that open, and this allows for the blood to leave the testes after surgery. And the cost of this one is usually between $8,000 to $10,000. And then the last procedure we could look into is a ejaculatory duct resection, and that's done with a small telescope in the urethra. No skin incisions are needed, and this is usually done in an operating room under anesthesia.
What current research is being done for my problem?
Okay, so for current research, we did find that in Israel, researchers are able to grow mouse sperm from testicular cells, and then in Japan, the living mice offspring from the other mice, they're able to take the stem cells and grow them into sperm in the testicles of the previously fertile mice. And then the generated live mouse offspring from sperm made from both embryonic stem cells and adult stem cells that were modified to look like embryonic stem cells. And they take the testes, and another study was they take testes tissue from when a child is young and freeze it, and then refer back to it, like if the adult male is like ready to have a baby, they can extract sperm from there.
I heard in your discussion something about oligospermia and azoospermia. Do I have these?
So Darnell, it is possible that you do have oligospermia or azoospermia. If you look here at this table, there is several types. There is a mild oligospermia, which isn't too bad at all. You obviously have 10 to 20 million sperm within you. And then there is a moderate oligospermia and then a severe oligospermia. You can see those numbers listed as well. But then there is a cryptozoospermia and an azoospermia, which is very dangerous because there is zero sperm, or even it's very rare. So it is possible that you have this, but I wouldn't freak out until we take any action into further testing.
Were any of these problems genetic?
So genetic abnormalities with your condition are becoming increasingly more common. As I previously mentioned, there is several tests that we can do detecting different Y chromosomes, extra X chromosomes, and then another test just detecting other abnormalities dealing with genetics within you, but that's very rare. Like I said, it's only 2 to 3%, but we will figure that out more as we do more testing.
A friend of mine who also had a vasectomy reversal was unable to conceive. What are the side effects that could have caused this in him, but not me?
So there are a few side effects that could have happened to your friend. There could have been a complication during surgery that had left scarring or any kind of technical problems. But also there could just be poor sperm production that just does not lead him to be able to become fertile. So there's many different things that could have happened, but those are the major things that could have.
I have heard about the benefits of something called nutritional therapy. Could you guys possibly explain this?
Basically, nutritional therapy is just having a very nutritious and healthy diet and taking in those nutrients such as zinc, selenium, and vitamin C, and there is many others that will help with developing strong sperm. However, it will not take someone from being infertile to fertile. It can only help, but it cannot change the state that you are in.
So some suggestions we have, the test we presented to you and the procedures, and also on the pamphlet. Just take a look at those, maybe do some research, see what kind of fits with the infertility and the testes problem you have. Also, I would refer back to the doctor and surgeon that had performed your vasectomy reversal. Maybe they have some previous history of how your sperm production and healthiness and like motility was before the actual procedure took place and also after. And then look at your family history. There might be some trace of infertility in there that you did not know about that you could get back to us and help us further find the cause of your infertility. All right. Thank you guys for coming in today.
If you guys have any questions about the brochure, let me know.
Have a good day.
Thank
Thank
you.